Hi guys, Trevor Philips was holding Victoria Atkins' feet to the fire over the conflict of bringing down immigration but providing the NHS and social care with the staff it needs. The Health Secretary must have drawn the shortest straw as she was doing the interview rounds. Phillips put it to her that the Chancellor Jeremy Hunt has promised to reduce immigration, claiming that it's too high. But as over half of the staff recruited to the NHS in 2023 were foreign, and it's currently understaffed, fixing one problem will deeply impact the other. She struggled to respond.
In June this year, 265,000 of those people came from abroad. That's more than the year before. Now, your colleague, Mr. Hunt, sat in that seat a couple of weeks ago and told me he wants immigration numbers down. If he gets his way, where are those 265,000 foreign workers in the NHS? And by the way, the similar number in social care going to come from? You're never going to meet your targets if he gets his way on immigration.
Well, all of our workforce, whether they are UK nationals or they have come from overseas to work in our NHS and social care system, are incredibly important to the system. And I genuinely thank them for their service.
It's like, the question is, how are you going to fill 500,000, split between the NHS and social care? How are you going to fill 500,000 positions? And your response is, these people are very important to us. Okay.
In terms of immigration as a whole, it is too high. We have taken, but there's more to immigration than simply health and social care visas. So
we've been here before. So we need to throw the entire NHS and social care under a bus because some other sectors, we want to bring down immigration within those sectors.
This year, we unveiled a genuinely game-changing policy of removing dependents from student visas. They take up quite a proportion of
Let me show you something. Let me show you something. Take a look at this graph here. A great number of the people you're missing, about a third, are nurses. Where are the nurses coming from? Those red bars are foreign nurses. And this year, 2023, half of the new nurses that come into the system are from abroad. So let me put it to you again. If Mr. Hunt gets his way to cut immigration, you'll never meet your targets because you will not have those nurses.
Well, this is where the long-term workforce plan comes into effect. And
the long-term workforce plan is to move people off benefits into work. So the idea is what we're going to do is we're going to move people off benefits, universal credit, whatever, into social care, move them into the NHS. But we're not actually going to provide the NHS with the means to train people up. People will just be moved in there. We're not going to really provide people with training, with the means to move into social care. We're just going to force people, it seems, to take up jobs, for example, in social care or in the NHS. Really? Is that the plan?
Earlier this year, we announced the long-term workforce plan for the whole of the NHS. Okay. I see it as the sort of building blocks for the next 75 years of the NHS. And the focus on this is about training our nurses and doctors here in the UK and supporting them and retaining them through innovative measures such as...
Oh my goodness. So the plan is we just want to train up our own, but we don't want to spend the money to train up our own. Now, there's a bit of conflict. It's a bit dysfunctional, to put it mildly, within the Conservative government because on the one hand, you have the Home Office saying we need to bring down immigration and the Chancellor to a certain extent, but it's mainly the Home Office saying we don't want to issue visas. But you also have government departments that are experiencing a massive amount of pressure from outside. So you have the NHS putting pressure on the Health Secretary. You have farmers putting pressure on the Environment Secretary, saying we need change, we need more visas, we need something like freedom of movement back because we can't get the staff we need. And the response from the Home Office is, well, just train people from within the country. But it doesn't work. It's not working. I think there's also an aspect of just allow, an aspect of what we say to the public is not actually what's happening on the ground. So what I mean by that is the Tories are saying we're bringing down immigration, but at the same time, we're allowing lots of people in because we need them. We can't have the healthcare system collapse. We can't have social care collapse. You know, they're pretty close to collapse, but we can't allow that to happen because it'd be embarrassing for us. So in order to stop it collapsing, what we're going to do is allow these departments to bring in some workers to fill those gaps. Is it enough? Of course not. So they're fighting this battle where they're trying to keep racists and bigots happy by reducing immigration, calling it a problem, but at the same time trying to fill the gaps within social care and the NHS by allowing people in. But also there are other problems. If the NHS can't get the nurses it needs to recruit them from the private sector. And if it's doing that, it's paying an extra premium. Now this is an extra cost that doesn't actually add any value. You're bringing in nurses from the private sector. Those nurses are generally being paid the normal rate, but the agency is making a lot of money out of this. This is a cost for the NHS, and this has to come out of a budget, which means that somewhere else is being cut. The Tory response should be, the government response should be, okay, government departments need, like the NHS or social care or government departments themselves, need staff. We need staff, let's bring them in. And to hell with the racists and bigots, because there are more important issues. But no, it's about chasing votes. It's about worrying about Reform UK or something like that. It's pathetic. It's dangerous. And it's destroying the NHS. Let me know in the comment section, guys, what you think. As always, your comments are greatly appreciated. Thanks a lot.